Good morning, everybody, to this new edition of the I3h seminars. So my name is Mathias Douatripon, and I will introduce today's speaker. We are very honored to have Charles WYPLOSZ with us today. Charles is Emeritus Professor of International Economics at the Graduate Institute in Geneva, where he has been director of the International Center for Money and Banking Studies. He is one of the top macroeconomists in Europe, having written many things on European monetary integration, macroeconomic policies, financial crisis, and so on. He's written textbooks that everybody reads in Europe on macroeconomics. He's also a very well-respected voice in economic policy in Europe and beyond, having advised multiple institutions. He's also an academic entrepreneur. He was one of the founders of economic policy. He has been really important for Center for Economic Policy Research, of which he was policy director. He was also director of the International Macroeconomics Program, and he's also not only he's almost also an academic disruptor. He was one of the founders of Vox EU, and most importantly for today, he founded COVID Economics, which was a huge success starting roughly a year ago, and which has really changed a lot. And it was a very important stimulus to economics research about this pandemic, and I hope it will also be a way to disrupt structurally the publishing business in economics. In economics, we always talk about efficiency, but we are the most inefficient at running our journals. And in that sense, rocking the boat is really important. And Charles has been doing that very successfully. And of course, this has made him the perfect voice to tell us about what economics has been able to understand about the current crisis. So thanks a lot for being with us, Charles.
Thanks a lot, Matthias. In your presentation, you forgot something very important for today, is that I'm no health economist. Last year, I knew nothing about this field, and I came completely from outside trying to run this review. But thank you for your very, very kind presentation. So let me share my screen. Hoping it's going to work. Yes. It works at my end. I hope it works at yours. Matthias asked me to present the economist's contribution to the pandemic. I'll do it mostly from my observation point, which is this review, COVID Economics. And let me tell you a little bit what happened. There is a field of it, on the economic analysis of pandemics, but it's a very small field, or it was a very small field back a year ago. There were people doing very interesting work, but very few of them, a bit more than 2 hands, the number of fingers in 2 hands, much more, not much more. Now, when the pandemic started to come in, two things happened at CEPR. So for those who don't know, CEPR is a network of economists, policy-oriented economists in principle. In mid-March, so really at the beginning, totally at the beginning of the crisis, the CEPR published 2 ebooks. They were edited by Richard Baldwin and Beatrice Vedder. And they turned out to be, they were a collection of essays by people who didn't know much about epidemics either, but tried to bring a very quick reaction from all the fields of economics. And this success led CPR to the idea of launching a review, COVID Economics. Now, what is and was, but still is very special is the idea was to be real time, so to publish papers in matters of days and not months and years, as Matthias alluded to, which is a total revolution in the way we work. Of course, it's copied from medical research and physics research, where there's a long tradition of preprints. This research was meant to be available online for free to everybody, and not to be a publication per se, but working papers, so preprints in the medical jargon. The idea was to, the perception was lots of economics coming from old fields and subfields and subfields were fascinated or scared or in any way very strongly motivated to try to think something useful about the pandemic and to make it available as soon as possible to feed this birth of knowledge. And the idea was to open it globally to anybody who wanted to submit something, and access was totally free, so no money in the skin. By the end of last week, so it's a bit more than 1 year, I have received 1,077 submissions, so it's a pretty intensive rate. I don't think of reviews. Well, I'm sure the medical studies publications had way more than that, but I was alone. We have accepted 470 papers about and published. They were collected in 75 issues. Now, when I say I was alone, that's not wrong. That's not right. I've been working with an editorial board of varying size, but between 35 and 50 people at times, who all accepted to read the papers and let me know what they think of it within 48 hours. So that was the revolution. The secret is that these people were extremely supportive, and they would indeed react, most of them within the time limit. Some needed a bit of reminders, but most worked very fast. There's a number of reviewers, I must say, that have the habit in responding within 1 hour. Now, vetted when I describe the review, it means it's not reviewed in the traditional sense where the referee is supposed to read everything and the appendices and to go over all the calculations. And then come up with 50 good ideas about how we improve the paper. Here, it's accept or reject. People send a paper. The reviewer goes quickly on the paper, try to check if it's A, correct, and that's the necessary condition, and B, relevant, which is the other necessary condition, and C, new, if there are new ideas in it. So that's what the reviewers are supposed to do, and the paper, if accepted, is published as it is within, as soon as I have enough papers to make an issue, I make an issue. So that's a little insider story. Now, just to show you, this is the issue number 1 that came on April 3rd, and just to show you what people started to worry about, there were papers on the long run effect. So it's a tradition in economics. It's easy to forecast the long run much better than the short run. So that was there. There was a very important paper about this, trying to detect who can work at home, and this opened the whole literature is on work from home. There was a paper on early observations of the lockdown effects, very economic aspects of the lockdown effects. So that was within a week. what, 2 weeks it started. There was an early study on the stock markets. The stock market collapsed and then they recovered. So a number of people looked at how exactly it was happened. There was another paper on stock market asset prices. And there was a paper, general thinking paper about what it means to resilience and how it's linked to governance. I've also put the last paper that came on April 7. Now the topics have shifted. Of course, here there is a study on how people who got money from government spent it or didn't spend it. There was a survey of how firms have adjusted in terms of employment and work at home globally. It covers a very large number of countries. There was also a study on the household division of labor. So it's the gender issue. Who does the cleaning up at home? Now there are children who don't go to school, and there are people working from home in the couple. So this is we had many of these studies. And there is, of course, a paper looking at the race between vaccination and infection. So that's not really strictly economics, but it was on one of the early paper on vaccination. I have more in the pipeline coming soon. So that's the presentation. Let me go to the issues. Just a quick warning. We've published 40-something papers. For the first 2 weeks, I knew exactly what was in each paper. In the next 3 or 4 weeks, I had an idea of what papers we had published. Now I can't. The space of the memory has been overwhelmed. So I'm going to try to tell you what we have done, but don't ask for too many details. In many cases, it's gone. Now, so early on, very early on, lots of economists locked in on epidemiology, which nobody knew about, but this was the great surprise. There was this field that since the 1920s, and there is a paper that everybody is quoting, Carmack and McKendrick, which does things very similar to economics. It does modeling at a time when I think economists were not yet doing modeling or very little of it. So these are these mathematical models that feed parameters and tells us how is the epidemic developing. So people were delighted to discover that there is a tool that we can use, we can quickly learn and use, and they quickly said, well, epidemiologists are really nice people, but there are things that they don't do, and they haven't looked at the impact, or few have looked at the impact on economic situations, so impact of the epidemic and what's happening around. They haven't looked at how people react or not the way we look from an economic point of view, I should say. There is a need to think about the policy measures that were taken, so lockdown and all of these things, how it affects economics and the epidemic. And the idea is that the two are closely interrelated. Of course, if people go to work, it's a different situation than if people don't go to work, and the economic conditions matter. So people thought having a loop between epidemiology and economic would be important. And I remember when we were just started, I remember reading an interview of an epidemiologist and say, we need economists to tell us what's going on. So that was our effort, our profession. And then, of course, economists usually say, well, there is something good in everything, but there is something bad in everything. So there are trade-offs, there is uncertainty, and the question is, what the hell do you do that's good under these complicated situations where you have to make choices? And that's optimality, and that's the bread and butter of economics. So people could come in with the whole machinery that we use. Now, let me mention a little bit in more details. First, the economic situation worsened very, very quickly. We went into one of the deepest recession. over the last 100 years. So there were very early measures, attempts at measuring the impact in detail, which industry, which people, and so on and so forth. And understanding what was happening. Was it, how important was working at home? How was important transportation? How important was trade? So within a few days or weeks, we started to get a picture of the impact on the economic situation. Then there was also a lot of work on how people and firms individually behave. And very, very early on, I think within 10 days, people came with results that people have been self-isolating themselves spontaneously before the lockdown measure. And that was very interesting and I think important. And remains important that people get scared. And of course, which people get scared, which people don't get scared. This was found pretty quickly, and the explanation of why they behave this way. There was also a lot of work on how firms reacted and what was the role of public support schemes that were adopted, at least in the developed countries. So all that got studied, both principles, what do we expect to see and what was happening. The policy measures were then studied, so epidemiologists were doing that on their sides. Economists were doing that, usually bringing some economic arguments or logical. I mean, we like to pretend we explain people's behaviors and firms' behaviors. So there was this effort to observe what was happening, and in terms of lockdowns, masks, mask wearing, what was the impact of local, national, and trade links. There were very interesting studies about saying what's happened in a neighborhood, given what's happening in the adjacent neighborhoods, and why. And as I mentioned, optimality was also part of the picture. Let me say a little bit on that, because that played an important role. Very early on, a large number, this remains controversial, but very early on, I would say a majority of papers were saying there is no trade-off between health versus wealth. So that's what we hear from the politicians. They say, oh, we cannot close down the country because this is an economic disaster. So that remains controversial, but my understanding is that most people have been arguing there is no trade-off. If there is a pandemic, people self-isolate themselves. They don't spend because they are scared. So if the health the situation deteriorates, it automatically, it mechanically affects the economic activity. So the idea, so the sort of, quote, Swedish idea that you can just enjoy good life while the virus is running around was quickly dismissed as not happening. There were a lot of studies early on also, and still going on, about optimality, with usually the question, now it has shifted a bit, but the question about what do you have to do to keep hospitals from being overwhelmed? Now there are a number of people working on the idea of zero COVID, but it's barely starting. I've seen one or two papers. Now my understanding of the what comes from this literature is that complete lockdowns are probably unnecessary, at least if other measures are taken quickly, very quickly. So the idea is that delays are catastrophic because of the exponential nature of epidemics. So but if you can come early and you can have people do spontaneously distancing, people self-isolate, firms adopt all sorts of measures spontaneously, And if you can have that started soon, then you may be able to avoid complete lockdowns. And I think that's what happened. We had the first lockdowns in the spring, I guess, following the Chinese model, but no country is doing that anymore, except maybe the zero COVID countries in like New Zealand or Australia. There was also very quickly, I mean, uncertainty is something that economists love to have learned to analyze quite smartly, I would say. So there was also a lot of people, there are lots of people still working on that. What do we do when we don't really know what's going on? So that there was work on how to, and there is work on how to adjust data that we know are imperfect. And there was also a lot of effort on the impact on uncertainty and the cost of delaying closing down, and the next cost in delaying reopening, because we just don't know, and policymakers tend to be delaying anything when they don't know. And that was studied theoretically and empirically. In terms of so leaving epidemiology, they were, in terms of trying to understand what was going on very quickly, but that was a matter of 2 or 3 weeks. The inequality aspect of the crisis came around. And let me say a bit more, because it's turning now to be an important development in the field, in research, moving quickly. So the question is, who is losing more in the epidemic? And very quickly it was clear that lower income people were losing most. They were seeing their income declining most. They were living in difficult condition, unable to isolate themselves. So they were also getting sick in larger numbers. They were also very often forced to work because they needed the money, especially if they were not officially declared, and so on and so forth. So an increase in inequality. And we had the same results for the other major inequality, at least within countries. I'm not talking globally, but women losing out in many aspects, including work, including income, including jobs, especially when they have children. Yet, what was found that the public support mechanism we had have helped to support average income. So the lower end was losing, the average actually did pretty well, and the top, as always, have done better. Here, there was a few days ago a new paper that came by Stephanie Stancheva, and I was pleased, so I put it in this presentation, where you have the decline of earned income. So that's how, on average, how people have been losing income by country. And the orange bar tells you the average decline before government support, and the blue spot shows how much government support has helped. So you can see, going from left to right, huge inequalities across countries. I don't see Belgium. Yes, Belgium is among the just slightly more unequal than the average EU. And you can see the blue dots, how much these losses in income have been compensated by government support. So the blue dot is showing how governments have been good at supporting. And if you look at the Netherlands, somewhere on the right, you can see that on average people didn't lose. And you can see in Finland that there was no public support at all. So these are, I am not going to spend hours on that. There were a lot of policy analysis comparing hard and soft lockdowns from both medical and economic point of view. There have been continuously analysis about the willingness of people to accept the distancing measures, and now this is going on about willingness of people to accept vaccination. There has been quite interesting contributions suggesting that we should differentiate lockdowns according to people's susceptibility of getting badly sick, so age and risk. This is one area where most papers are saying it's very efficient to put old retired people and risk people at risk in lockdown and let the others run. So so a little bit of a Sweden and a little bit of a tough lockdown. This has not been done, as far as I know, anywhere in the country, in the world, and yet that's what most papers were suggested. There were people looking at stop and go, still people looking at stop and go versus continuous lockdown, usually concluding that continuous is better than stop and go, especially if stop and go is very tough. That was not, well, that was done in some countries, but mostly most have been on the stop and go mode. As mentioned, analysis of income supports, which ones work, which ones don't, how efficient they are at curbing inequality and the worst suffering. There was a little bit, but much less than I expected at the beginning on trade, international trade, and disruption of supply chains. There was, I mean, there has been, and there is still some, but the trade economists have not been really excited in large number like the others. And I also thought that there will be a lot of work from economic historians telling us about the Justinian plague or the Spanish flu. There has been, but very little. In fact, it turns out the economic historians have done a lot of work on pandemics and epidemics for years and years, and so they were not that excited to tell us what's going on, and that's a bit sorry. Now the analysis have also covered vaccination, so the idea of public prepayment or private-public partnerships and risk-taking. So this is something that sort of milk and honey to economists, how to make vaccine research efficient and fast and so on and so forth. That was identified pretty early as the way to go, which is what the US and a little bit the UK did, but not us Europeans. There is quite a bit of work going on the cost of delaying vaccination. So if you want Israel versus Belgium, just to take randomly two countries, and people put numbers on death and economic impact of being 2 or 3 months behind the leading country. There is also work on the nationalism of vaccination, so where economists understand that governments are elected by voters who want to be vaccinated, so they are nationalistic in their approach, and at the same time there is unanimity that this is costly for everybody, globally very costly and not a great idea. There has been work now over the last 2-3 months on the recovery, and the topics there was what's called scaring, namely saying what has been happening over the last year will leave a long-term impact. People who have not been working for a year will find it hard to get back to work because they have lost connection for the labor market, or firms well, the example here is aviation. Will people start traveling again in the future, and when, and what's happening in the meantime to all these planes and to the companies who are not flying the planes? So this is the idea of scaring. There is also a lot of concern about the zombie effect, namely that the public support to all firms means that firms that should have disappeared are still around and will try to get more resources. And there are data showing that, as we all know, that the number of defaults by firms has fallen dramatically during the crisis because everybody's getting money from the government. And there's concern that the low mortality of zombie firm will keep resources in firms that are not innovative and should disappear, and could slow down growth and innovation in the long run. And of course, all countries have borrowed huge amounts of money to pay for all of these things. So they are now much more indebted than they were before. Italian now starts looking like Greece during the Greek crisis. So how are we going to deal with these debts? And this is a pretty controversial field where people get hyped up. Now, overall, I've tried to present to you a very quick review of a massive amount of work covering all the areas of economics. I mean, we have our tribes, and each tribe has been contributing, and it's been amazing. Now, as I mentioned early on, there is a large amount of detailed information that I couldn't present, first because you would get bored, and second because I may not be able to sort of immediately, it doesn't necessarily come to my mind earlier, but I can try harder if there are questions. What has been interesting also is that a lot of information has come from different countries. Of course, Europe and the US have been the most studied countries, largely because of data availability. But there has been a lot of information of an amazing number of countries. Over time, I have stopped accepting yet another paper doing the same thing for yet another countries, because that's, in the end, it's borrowing and boring. But it is interesting how the economic of pandemics has taken over in many places of the world, with sometimes very creative contribution. Much of that research, I think, is now conventional wisdom. I say that when I read newspapers, I can see a lot of things that appeared in research 6 months ago. That was very surprising 6 months ago, and that is now considered a fact. The question I have, and it's you may know better than me whether policymakers listen. I'm thinking of Matthias, who I know is talking to policymakers. I often have the impression that they don't, but at the same time, I understand that policymaking is a different game than just doing optimality computations in economics, and that policymakers have to deal with sharp political issues, and I understand they are complicated. But it is frustrating in many respects to see that mistakes are done very often with the eyes wide open, at least what we consider as mistakes. One thing I want to mention before closing is that we economists love to disagree with each other all the time. That's called scientific research. In this case, I've observed a surprising degree of convergence of results, as if we were so concerned collectively, individually, with this tsunami hitting us and our economies, that we lost appetite for the fun of disagree with each other. It's not that everybody agrees on anything, but I've seen very little effort to attack previous papers. People usually try to improve of previous papers, which is more civilized but maybe dangerous. So we may be developing conventional wisdom that's not necessarily correct. And now, as far as this review is concerned, I'm looking forward to close it down because there is no need for it anymore, hoping that there will be no need and that the pandemic will end, but that we don't know. So with that not very original thought, I will stop and then be delighted to discuss and provide whatever answer I am able to provide. Thank you very much.
Well, thank you very much, Charles. Very, very interesting, very rich. Are there questions?
Philippe Verwemp has a question. Philippe, are you there? Yes.
And Joseph Thomas also, but maybe Philippe first, yeah.
Yes, thank you very much for your interesting presentation. I'm wondering, as you said that several or many economists have advocated for differential lockdown according to age and risk. But in my opinion, this is dangerous because you cannot separate generations, right? So if risk-taking youth go outside and do not have social distancing anymore, they risk spreading the virus, and then when they return home, they contaminate their parents and grandparents. So can you expand a bit on that? Why economists would have advocated these differentiated lockdowns?
Okay, this is a beautiful question because I think it shows how economists can differ from epidemiologists. The idea is exactly as you say, namely, if people, you make classes of people by age and risk, and if they never meet, never, then it's obviously a good idea to put in the freezer the old people or the people who have comorbidities. Now, if they meet all the time, then it's not going to work. And the question is what happened in the middle, in the soft middle, where people meet occasionally, but they are careful about meeting. They're doing the distancing, they wear masks when they meet, and they try to not meet very often. And then you get the mixed bag in terms of the epidemic. But then if you look at the economic impact, what I meant before, if you tell all the retired people to stay home, they were not working anyway, so there is no cost in locking them down. And if you tell all the younger people to go to work, they are the people who create the economic activity. So as economists, we agree that the world is not one where you can completely isolate different tribes, let me say. But it's not the world also where the tribes mix all the time equally, as much as with the other tribes as they meet inside the tribe. So we are in the middle, and the economic benefits can be important and can be worth exploring. So there might be a bit of a cost in terms of people getting sick, because grandparents, I am a grandfather, want to see their grandchildren and they can get sick. But if people do that very rarely and take precautions when they do, it's not going to be a full-blown contagion, and the economic benefits of doing that are quite important. And that's sort of the idea of trade-off, of optimality, saying there is no absolute priority to put on this or that. You have to make the two things happening at the same time. Is that an acceptable answer?
Yes, yeah, that's very much acceptable. It just is that people have to be very disciplined then. And I think many of us are disciplined ourselves, especially in academia, because we can work at home. We are highly educated. We are, self-disciplined, I think more than average. But it seems to be unrealistic to expect from everybody else that they're as disciplined as many academics are. And when we look around us, we see that people are just not disciplined, especially after many months into the pandemic. and then asking or advocating that the youth should go outside and the older people or middle-aged people should not meet with them, even in the trade-off, seems to be quite unrealistic.
Okay. Yes, you are right. What we know, I mentioned that there have been a lot of studies showing, and I think you must know that the people who are more careful are typically the better educated people, the wealthier people, and not all of them can work from home, but the people can work from home are usually from the higher socioeconomic education levels. So this is the issue of inequality, but it has a strong impact because, as you say, people, groups of people sort of, the low on the socioeconomic education scale don't distance themselves, and they spread the sickness. So that's absolutely true. And that, I think, is taken care in these studies I've seen. There is an acceptation that when you try to encourage some groups to self-isolate or to be very precocious, they are not. So that's why the epidemic is spreading. If everybody was extremely precocious, this might not happen, or it might not happen on a serious scale. There's nothing, I mean, education, of course, but there's nothing much that can be done. And I think that's taken into account in some of the studies, the fact that you'll never hit 100% success, but you'll never get to 0% success either. And again, this is this whole idea of the soft belly, of not being too ambitious in any respect. So accepting that there will be a serious economic recession, and accepting that there will be a lot of contagion. And as I said before, the usual argument which comes from the medical profession is that what we need to do is to let the hospital work without completely overwhelmed, not going to zero COVID.
All right, thank you very much.
You're welcome.
I think Josse, Thomas?
Yeah. Thank you for creating this forum on COVID economics, and thank you for your presentation. I was just wondering whether some of the Spec mania that we see now on the stock markets versus the more traditional IPOs is fueled by the COVID-19 pandemic.
That's a question I have no answer.
Well, has there been any research on that, or?
No, I haven't seen. As far as I'm concerned, I haven't seen any of that. I mean, Spec is just started, from what I understand, and haven't.
Yeah, but it is already there since several decades. But now all of a sudden it explodes.
Yeah. Good question. If you're working on Spec,
no, not at all. I'm not an economist.
Okay.
I'm just interested.
I haven't seen anything. There's been a little bit on this bubble on the market a couple of months ago, but that's not something that got financial economists excited either. So sorry, no, we don't have answers to everything. Thanks God.
Okay, thank you.
Wu Chong?
Oh, hello.
Hello.
Thank you for your talk and thank you for the review. I was wondering, so if there have been some review or paper analyzing the situation that from countries that work well, for example, New Zealand or Vietnam, and their measure, their impact, and why couldn't we implement such measure in Europe or USA?
Okay, that's something that I think, well, I wouldn't say well understood, but the view that I have seen, it has to do with the speed of reaction, and the fact that countries that have been affected by previous SARS and all these previous epidemics over the last 30, 40 years. First, the authorities have worked out contingency plans informed by their previous experience, and so they were ready. They knew what to do. Whereas in the US and Europe, the view was, this is not for us. We'll never have that. So we're not prepared, and the population too was in a way trained. So I'm not going to claim that everybody there is serious about distancing, but there has been spontaneous distancing. So this is the case where there was the possibility of very early curbing the spread before it gets to a huge number and out of control. There was also track and tracing, which we all know in theory is very good, but you can do it only if you have small numbers to do. So I think Korea was great on tracking and tracing and locking down sick people or isolating sick people. So that's the usual story. Now there are the special cases of sort of the New Zealand case of a small island in the middle of a huge ocean. That's easy to close down. One of the problems we have in Europe or they have in the US is that people, even if you lock down, you need to transport food, you need to transport oil, you need to transport things. So people move around and they usually don't move alone. They bring along with the coronavirus. Whereas some countries were better able for their own reasons to isolate themselves. This I think are the reasons why some countries have been doing much better.
Thank you very much for your input.
Yes, thank you. I do think, building on that earlier question, I think that while clearly some good performers have remained good performers, and indeed China, Japan, South Korea, Taiwan, Singapore, New Zealand, Australia, I think what has been happening in Europe is interesting, because I think in the first wave there were clear poor performers. The UK, Belgium, Netherlands, France, Spain, Italy, and of course Germany did much better. Austria too. All of Eastern Europe, all of Scandinavia except for Sweden, which was also a poor performer. But like today, when you look at the rankings, Eastern Europe is really in trouble. You know, Czech Republic, Hungary, but others too. And then Germany is looking less and less good in a sense. And I think it has to do, and I don't know whether there is research on this, on the political economics of these kind of things. You know, lockdown fatigue that can be. Now, interestingly, and epidemiologists talk about that, the fact that if you're really successful at preventing a flare-up or an epidemic, people start rebelling against the measures because they don't see the problem anymore. And you know, there was the for a completely other reason, there was the invasion of the Capitol in the US. But earlier on, there was the invasion of the Reichstag, and that was historically significant in Germany. And interestingly, a country like France, known to be a bit anarchical and râleur, they are now accepting measures that are extremely strict. In Belgium, French-speaking Belgium in particular, they are much more rebellious. I don't know whether you have seen work on these kinds of things, on political acceptance of the measures, and what your thoughts are about that.
Okay, I haven't seen yet, and I'm waiting anxiously to see the first papers explaining why Germany did well first time and not second time. This kind of papers, why, the winners of last time are not the winners of this time in terms of effectively fighting the pandemic. So I haven't seen that, and I very much hope to start seeing the first. I'm sure some people must be working on that, but it hasn't yet matured. Now, on your wider question, so what we know is that success, let me say it this way, success factors within a country, there's been a lot of work, say, in the US, saying that the areas, and that's not state, but at a lower level, that have done better, usually have a lot of what we call social capital, namely people who are organized in hiking together, having social clubs, listening to music, whatever. When there is a high level of cooperation within a neighborhood or a village or a region, these people care for each other, and there is less pandemic. They self-distance themselves no matter what they are told. Of course, education, I mentioned, is extremely important. One of the results that we know has been known forever is that density of population matters for the spread of the virus, but that's obvious. Then there are the politics, and again and again, we've seen results that the areas that voted for Trump, people did not self-distance, and they got much worse. That doesn't mean New York City voted for Trump, but it's a very dense place, so it works the other way around. So political opinions matter a lot. And in the US, it was really the Republican-Democratic divide. In Europe, there is a little bit of that playing as well. Who are the people who... so it relates to individualism versus collective responsibility. A lot of people say, I want to preserve my freedom, ignoring that they become vehicles for transmission. So that's sort of philosophical, political, and that has been pretty well documented in many ways. But that doesn't explain why Germany did well the first time and did badly the second time. One interesting, maybe relevant result is that when governments take tough measures and the neighboring governments take equally tough measures, then the tough measures become legitimate. That's why I think the very early reaction to strict lockdown was probably largely influenced by China, that lockdown, as we know, ferociously. Now, if you take that seriously, then you have the Germans and that's what I think you said, Matthias, the Germans that were successful the first time, they look at the neighbors, like the French and the Belgians, and they say, well, they had strict lockdown and it didn't work, so they did very badly for reasons that we don't quite understand, and they don't want to do it anymore. And I think, and that's something my personal reaction of observing is fatigue. So we had a couple of papers in fatigue, like the epidemiologist explaining why it's natural for people to get tired with this measure. And fatigue is playing a very important role politically. Now, you say France is disciplined. I don't think it's more disciplined than Belgium. It's the country of the yellow vest, and they are still bubbling in the background. And obviously, the government is completely scared, and that's why the country is late in taking strict measures. And I think you see pretty much the same everywhere. Look at Italy; they are preparing to open right now, although there is a lot of circulation, infection going on. There is a new government, and it doesn't want to lose too much political capital on these things because they have higher objectives, sort of historical objectives. So I think there are deep political questions here, and economists like to talk about politics and to do research, but haven't seen yet quite a good answer to what's happening with this wave.
Okay, thank you. No, I agree with you. If I don't see other questions at this point, let me ask another one, if I may. You did mention, maybe I was wrong, but that there was a risk of less innovation. If I, to me, what we are seeing now, maybe it's not innovation, but clearly there is diffusion of new technologies that is pretty amazing. At some level, what we are doing now is talking by Zoom. Now, this is at some level a completely standard technology. You know, this is Skype, Skype for Business or whatever, which existed. But all of a sudden, we have massive diffusion of that technology, which I think might change the way we work really importantly. I remember having been at the National Bank of Belgium, having to go all the time to Frankfurt and the like, and asking, you know, why don't we do this by Skype? And, you know, it seemed too complicated. And now, boom, all of a sudden, it's really massive. And I remember a paper by John Van Reenen and co-authors about in the AER saying, you know, Americans do it better, and it is IT. And it was a clever study about looking at multinationals in the UK, Americans and others, and showing that the US firms were much better, not necessarily at producing new IT technologies, but that which they're pretty good at also, but that the key difference macroeconomically was their ability to implement it in non-IT firms. And I would think that this current shock is really a very interesting case study to look at diffusion. I don't know whether there are already papers that have appeared in COVID economics on this, but to me, that seems like a massive fact, I think.
Okay, so before I said that there has been a surprising degree of convergence among economists, I think this is one area where there are sharp differences. I mean, right now there has been quite a bit of concern about what I call scaring. So the idea that the economies will start growing as fast as before, which wasn't very fast, especially in Europe. People are worried, no, that's not going to happen. It's going to take a long time to get rid of the scars from the crisis, the epidemic. So this is one view which has been developed. Then there is the other discussion saying the world has changed, and there are new technologies that have not been adopted, as you mentioned, and are now being adopted, and they are not going to go away. And I think that's pretty clear. And there will be also new technologies born of the experience we had. People are thinking very hard about doing better things we were doing sort of mechanically, because that's the way to do. So there are really these two views. As you know, Matthias, there is a big debate about growth in general, whether it's going to go up or it's going to go down. So it's reflected. In a way, it's the pessimist versus the optimist. And the data don't clearly, I mean, cannot say this group is right, this group is wrong. This is a long discussion, which is now bouncing back. So yes, maybe, who knows? We were never able to have a collective, at least that's my reading, view of long-term growth before COVID, and now it's worse because it's so much has happened that there is a potential for going up or down at the same time, and both things can coexist. I'm sure that we'll spend less time traveling and to meet uselessly. If we meet uselessly, at least it's cheaper to do it on Zoom, as you said. So there will be some benefits, and there will be some costs also. One of the things, there have been a few papers on populism, the link between COVID and populism, and linked to, well, first, reaction to distanciation, reaction to vaccines, and so on and so forth. So there is these things going on. They also, this discussion is also some people have started to worry about what you call fatigue, which is frustration 1 year or more now of living in difficult situation, and the growing inequality. So the people who worry about growing inequality worry a lot about populism and so on and so forth, which may lead to, well, a bit what we have seen in the US over the Trump period, sort of disturbance of politics, which some people, again, here you have the pessimists who are ready to describe a dark plunge away from democracy. Most people are more careful about that, but that's a little discussion that's taking place, which might have important economic growth effects going forward.
Can I ask you something? Yes, with respect to economic growth, are there studies submitted on the geopolitical and economic advantage of Asia over Europe and the threat that this poses for our knowledge economy?
Well, of course, lots of people are worried about that, but I haven't seen any paper on that in my own garden, and I haven't seen that link to COVID. Now, of course, political scientists or politicians are talking a lot, and news people are talking a lot about how China did it versus how the US did it, and now they have this vaccine diplomacy and so on and so forth. I haven't seen any economic analysis of these things. I'm trying to remember hard, but no, sorry, no answer to that one. At least in the direct link to COVID, beyond what you read in the newspapers.
Yeah, because of course China was already busy and maybe a threat, but Russia is now also really gaining advantage.
Because they have a vaccine that they can sell. Yes. I mean, I have seen nothing on the efficacies of this in my part. I mean, again, I read the newspapers, so I've seen nothing. Now, the impact of vaccine diplomacy, that's certainly not something for economists to, so we can all have opinions on that, and I have my opinions, but they are not particularly interesting, because that's not something in our coming from our field. So I can see what you think about, and it is very interesting, but I don't think I have any particular advantage or comparative advantage in dealing with these issues.
Okay, thank you.
Maybe, I don't know whether there are other questions. Otherwise, maybe I can just ask one last one on my side, at least. You know, in Europe, we often think of our health system as good, because, you know, social democratic systems, we fund them properly and all that. Of course, much better than the US, which is much too expensive and not performant, all that. But in general, we've been proud of it. And then boom, Europe has not done well in this epidemic. Now, is it because we are only focused on chronic disease and the like, and we don't care about pandemics? Or is it something deeper? Have there been studies on this? You know, for example, this idea in our country and France also, they say, oh my God, we are not spending enough. And if one part of the budget that has grown structurally, okay, there is of course aging and the like, but clearly we are spending a lot in our countries, even though we are avoiding the unproductive spending of the US. But and then when you look at different countries, I mean, country like Greece is obviously has been a victim of austerity, and you know who is responsible for that we can discuss. But clearly, Greece has had a healthcare budget that has been cut quite savagely over time, and they've done reasonably well in the pandemic. So, have there been studies on the determinants? Because it may be that it's non-pharma measures that make sense. It's discipline, social capital, alert politicians, but clearly in Belgium, in France, the view is we should spend more on healthcare. And I do think, by the way, in Belgium, we don't have enough nurses. So there are, one should do adjustments, but I don't know whether this has been studied.
Okay, so as you know, health systems are quite different from country to country in Europe, both in terms of funding, in the way they operate, the role of the private sector, and so on, and all of that. So there is an important part of health economics as a field that is working on these issues. Now, these people, to my surprise, haven't done much or haven't sent in my direction, so I can't follow what's happening in our reviews. But I haven't seen much, and I've seen nothing on the systems as such. What I have seen is that when people try to understand the pandemics in different countries, they look for potential explanations beyond the usual epidemiological things. I mean, you know, co-factors, and there are some of them have brought in spending, you know, the role of spending health budget. And my recollection is that it never comes really significant in this pandemic. So this is a particular question. So this is your Greek story. A small budget hasn't led to a disaster, and a very ample budget, I don't know where there is an ample budget, but higher budget elsewhere hasn't necessarily brought in success. That's sort of my recollection. I haven't seen studies saying, well, this is very important to put more money in health if we want to fight COVID economics. And I think the absence of any causal relationship may explain why the health system people haven't produced necessarily new results about why should we do with our health systems to deal with the next pandemic. My perception is that there might be doctors around here who are going to complain, and I may be wrong. My perception is that dealing with the pandemics is not really high-tech medicine. Developing a vaccine is, but taking care of people when they are sick is not necessarily high-tech and doesn't necessarily involve a high degree of sophistication. That there are procedures that are widely shared across the world of how you deal with when people have this kind of diseases. So that's not where having a health system, very developed health system, plays a crucial role. Of course, the number of beds in intensive care unit is important. We all remember when the Italians had to turn off people early on, and that has increased death, but I don't think that's what happened in Belgium. So I have the feeling that epidemics is a special animal that sort of is not necessarily linked. Maybe, by the way, my understanding of the big weakness in Belgium, and it was also in Sweden, is the number of older people living in special institutions that were not, well, first, there are a lot of people in institutions, and second, they were not dealing properly with the epidemics for all sorts of reasons. Now, that's not high-tech medicine. Keeping grandparents safe in an institution is pretty low tech, and it may not require a lot of money either to make big differences in numbers at the end of the story. That's my perception, but this is a good question, and frankly, I expected to receive quite a number of papers from health economists explaining how the system were better here than there. I haven't seen that. And the fact that it doesn't show up in our regressions when we try to understand the number of deaths or the number of infected people suggests that it may not have been a crucial factor.
Oh, thank you. I agree with you. By the way, on this issue of number ICU beds and the like, I do think that it can cut both ways, huh? Because a country that has a lot of ICU beds thinks, okay, I can take a couple less. In fact, you heard a lot about, in the beginning, some southern European countries like Greece, I think Portugal was doing reasonably well also. And then some Eastern European countries, including Romania, Bulgaria, did well at the beginning. The view was they knew they didn't have a very good health system, so they had to be very cautious. And I must say today in Belgium, and I've already made the point, and it's not just a joke, but maybe what we should do in Belgium today is divide by 2 the number of ICU beds, because it's only when they start filling up that the population and the politicians wake up and say, okay, now we have to get serious with social distancing and measures and the like. And because, you know, the amazing thing is that people get used to seeing people dying. Huh? We had the first lockdown in March in Belgium, which was the strictest by far until now. We had less than 10 deaths in total. Today we have 40. And by the way, now we have vaccinated fully the retirement home, so nobody dies there anymore, almost, or one a day. And we have 40, and that is really, and then people say, you know, I'm fed up with wearing masks and not being able to have a party and the like. Huh? So I think the political economics is really important, and there healthcare capacity can work in a counterproductive way.
Right. So when I hear you talk, it makes me think that a big part of our empirical paper trying to determine the impact of policy measures on the health situation, the authors, the good authors, worry about the fact that policy measures are driven by what's happening, so number of deaths. So this is, you know, the causality for if there are economists around, this is the crucial causality and identification problem. And it's very clear, and there have been studies showing that the policy measures taken by government depend a lot on the situation. So as you say, the number of available beds, if you don't have available beds, that sort of wake you up in the morning, you have to do something because you can't take care of people. So the number of available beds, of course, the intensity of the epidemic, the number of people who die, and so on and so forth, this has a very strong effects on governments, and that's very well understood, at least by the economists, and pretty well documented. Now, what you say is that emergency encourages caution. That's also true. So when we try to understand how people behave in terms of self distancing or wearing masks and all of that, it's very clear. We have quite a lot of results on that. That people become much more cautious when they live in an area where people are sick, or when they have relatives that have been sick. So this is sometimes called neighborhood effects, are very strong and have a very clear impact on people being prudent or imprudent. And we've seen that repeatedly, and that may be a part of the story about the Germans' bad surprise, that when people don't feel that they are personally at risk, they don't take precautions. That's been extremely well documented, and we have numbers, precise number of how it works. So yes.
Okay, I think Yvonne has a question. Yvonne? Well, if the sound doesn't work, maybe I can read it because it was also typed in the Q&A. It says that the shortage of qualified nurses is a huge gap in care, not only in this pandemic, but also more structurally with Europe's aging. And it's true that I heard that indeed next to ICU beds, you need people to take care of patients there, especially COVID patients. They require a lot of attention.
Yes, can you hear me now?
Yes, sorry.
Yes.
Thank you for transcribing while I was looking for my audio. That's my point, because this, I think, as a continuation, as with the example of Zoom, and we never used Zoom and now we use Zoom. We never had the hospital at home, but I know at least here in Switzerland, these are serious discussions now that we take. And in the US, I have seen reports that we take those people who just need observation or have complex chronic diseases and need care and can't find them in a nursing home, need to go to the hospital today. I'm thinking of paraplegics, I'm thinking of COPD, I'm thinking of severe asthma. They should tomorrow get that care at home or in a specialized nursing home. But the real problem at the moment we are facing here in Switzerland, and I'm sure in Belgium and in the US, is finding these qualified nurses. We can go and get them in China, but that's probably not the long-term solution. And as we have seen with Zoom, unless you can have the IT, but unless you're forced to change your behavior, human beings try to keep what you're used to. And I think it's the same with nursing. Unless they get paid better and unless they get rewarded better and policy makes this possible, this will not change. But that's a huge gap, I feel.
Right. So this reminds me of the discussion earlier raised by the question raised by Matthias about the longer run impact. He was worried about growth. You raised the issue of health services. Right now, it's very clear that in every country, people are very sensitive to health services. That's sort of been in the front of every newspapers for more than 1 year, and the lack of nurses, the lack of research, the lack of beds, and so on and so forth. So this has been on the forefront. And the question here is, will that have an impact on health policies in the longer run? Now, I can see one argument saying that's an easy win for politicians to invest in health services, training and hiring nurses, among other things, equipment and so on and so forth. But the question I have is, once the epidemic is gone, maybe people will want to forget about it. And that may not be a good political move to switch money. One of the things I may mention, I've always been, I mean, that's my observation of policy in France, but I'm sure it's happening elsewhere. Politicians always defend taxes by saying, oh, we have to build schools, we have to develop our hospitals. It's always health and kids that is supposed to be benefiting from taxes. They never tell you about where much of the spending goes, not in health and in kids. So it's a good slogan, but in fact, and that's, as Matthias said, that doesn't mean that health and school have had a generous budget over the years. So I'm concerned that once this is gone, the current enthusiasm for spending more for health will wane and will not be a potent enough influence on politicians to do what we today all think is an absolute necessity.
Okay, yeah, I see your point, spending more, but how about saying spending less in the hospital and spending better quality and for better food in a specialized home care, you know, environment where you need the nurses 7 days on 7, 24 hours, you know. That's the value proposition I have seen for Switzerland, and to my understanding, that could be attractive, maybe still not for politicians, but for economists and for insurers, this is clearly attractive, given that we are aging.
That's okay. Aging is important because old people vote, and they vote more than young people. So this is the so-called Grey Panther story. So yes, aging will create pressure for possibly spending more on health, and also for better retirement, better quality of services in hospitals and like that. So yes, the old people may help move the things in this direction, probably more than the young people who have gone through COVID and will not want to hear about health anymore because they feel they don't need to. It's going to be, again, as I see it, it's what we call political economy, namely the idea that the governments deliver what will then win the next election. And therefore, it's a question of how public opinion will mobilize itself after the crisis. Now, what is a bit reassuring is what we discussed earlier, the fact that the countries in Asia that had experienced some of these similar epidemics in the last 20 years have been able to react much better. And it was partly behavioral, the fact that people know how to wear masks, you don't have to explain it to them. And it's partly because policies were there, and I suspect partly because means had been set aside to deal with this kind of epidemic.
Fair point, very fair point. I personally, while aging, would prefer to eat in a good, well-equipped nursing home than in the hospital if I had to go there.
Sure. But then somebody has to pay for that.
Yeah, fair point.
Now I don't hear Matthias.
Yeah. Okay, thank you. I think it's almost 2 o'clock, so we've gone to the limit, but it was a great presentation and great exchange afterwards. So thanks a lot.
My pleasure.
Thanks to everybody for listening, asking questions, and so we'll be in touch. Great, thank you.
Goodbye. Thank you.
Bye.